BeakerBeat.
It's Monday, August 29, 2011. In this week's BeakerBeat, the NIH announces plans to improve transparency, but is it a real fix or just a Band-Aid? We'll let you know. Plus, are there no limits to the wonders of Botox? The muscle relaxant can fix your face, but now it's clear to fix something entirely different. Find out what it is. And do you live in a pigsty? Haven't cleaned out your fridge in years? Then you and the microbes you're growing in your house may be just what researchers are looking for. All that and more in this week's edition of BeakerBeat, brought to you by Allergan. To learn more about Allergan, visit their company webpage on Beaker.com. Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. Hopefully you survived Hurricane Irene. We here at Beaker just got some rain, nothing serious, which is good. We did want to do our show in the hurricane, but that's not really safe. So what we decided to do was reenact it. So joining me this week are Ugly Boy and Lila, and they're going to help us out with what it would be like doing the show in a hurricane. But first, here's this week's top story. Awesome. This is going to be great. As many of you know, the National Institutes of Health provides tens of billions of dollars to researchers each year, making it the single largest source of support for scientists at work in the drug field. But now the rules have changed on how people can get some of that cash. Investigators who ask Uncle NIH for research support will have to comply with finalized rules, requiring them to detail any financial ties they have with biotech, pharma, and medical device companies. The magic number is $5,000, whether it's cash or stock or what have you. These new rules have been in the works since revelations about millions of dollars in undisclosed payments between pharma companies and researchers forced officials to begin a review 2 years ago. The NIH needed a way to require researchers to detail their ties to biopharma companies without hindering their work or making it overly burdensome to manage the information. Officials claim that last concern caused them to nix a proposed rule demanding that the financial ties be readily accessible by the public. A variety of advocacy groups immediately took the NIH to task for falling short on its conflict rules. Paul Thacker from the Project on Government Oversight told the Washington Post, quote, "They're playing hide the ball on this," end quote. Maybe, but doesn't everyone in Washington do that? So this is what it's like in the beginning, a lot of rain and that sort of thing, hard to see. But anyway, tell us what you think about this story or any story you see in today's show. It's very simple, click on the orange button below me, a box will pop up, type in your comments, send it to me, I promise I'll read and respond to every one of them. After a while, the wind really picks up in a hurricane. It gets a little windy. It's a little much. And when you're done watching BeakerBeat, check out Beaker's blog and find out why some growing biotechs are packing their bags and moving. Here's a hint. It's all about talent, not a hurricane named Irene. That story and more on Beaker's blog. As the storm gets closer, it's really hard to see or breathe or anything. It really intensifies. This sucks! I would want to do this for real! After curing baby boomers of their wrinkles and the ability to move their foreheads, what could be next for one of the world's most famous anti-aging drugs? How about treating overactive bladders? Botox, is there no limit to your powers? Allergan has won FDA approval for a new use of Botox, the injectable muscle relaxant. It's been cleared to prevent overactive bladder in patients with neurological problems, including spinal cord injury and multiple sclerosis. It's only expected to bring in up to $60 million in extra sales, but it could signal much broader use and soon. The company is in a late-stage trial testing Botox against urinary incontinence, a fairly common ailment. Some analysts predict an approval for that issue could add up to $400 million to Botox sales. A couple of hours ago that Hold on! Novo Nordisk plans to spend $192 million to build 2 new headquarters buildings in Bagsvard, Denmark. The company will break ground in October, planning to consolidate operations from Copenhagen by the end of 2013. GE's move to China has begun. GE Healthcare cut 81 manufacturing jobs at its facilities near Milwaukee. The layoffs come a month after the company announced it was moving X-ray business headquarters from Waukesha, Wisconsin to China as part of plans to invest $2 billion in that country. GE's Wisconsin operations manufacture diagnostic imaging and X-ray equipment, among other items. Steeris is adding 50 workers, mostly engineers, at its headquarters in Mentor, Ohio. The sterilization products firm plans to create about 300 more jobs soon with the opening of its $11 million customer solutions hubs there. Spain's government has approved new rules designed to boost generic drug use. Infarm reports the new laws require doctors to write prescriptions using a drug's generic name. Pharmacists must then fill the script with the cheapest available drug, usually a generic if one is available. On-patent brands are protected as they don't have generics for substitution, but older brands like Lipitor, which recently got a generic copycat in Spain, could be left out in the cold. While HPV vaccines are mainly used to protect young women from cervical cancer, the shots have also been found to prevent other types of disease, including penile cancer and genital warts in males. Now a new study has shown that GSK's Cervarix may also prevent anal cancer in women. The NIH-sponsored study monitored 4,200 female patients inoculated with Cervarix. After 4 years, the vaccine had prevented 62% of cervical cancers and 77% of anal cancers due to HPV. You may recall that actress Farrah Fawcett succumbed to that type of cancer in 2009, bringing attention to one of the more rare forms of the disease. From the odd but interesting file, the U.S. Patent and Trademark Office has issued its 8 millionth patent, and it went to a medical device company. The lucky recipient is Second Sight Medical Products for a visual prosthesis apparatus that enhances perception for people who have gone blind due to outer retinal degeneration. The product, Argus 2, is in U.S. clinical trials and has received marketing approval in Europe.
He throws more wind at you! Very hard to stand! Oh! Hard to stand here.
Baxter International will pay $380 million for Baxa, which develops pharmacy technology for oral and IV dose preparation and delivery. The deal is designed to enhance Baxter's nutrition and drug delivery business. Par Pharma is adding to its group of generic meds with a $410 million buyout of Anshin Pharma. The deal will bring in 5 marketed products and another 27 awaiting approval from the FDA. Privately held Irvine, California-based Anshin focuses on extended-release generics and niche knockoff drugs. Medtronic announced financial results for its first quarter of fiscal year 2012, during which it had net earnings of $821 million, a decrease of 1%. However, the results did meet analyst expectations. The company reported worldwide first quarter revenue of just over $4 billion, an increase of 7%. So time for our last story of the day, and by the way, you can see that eventually the skies do clear and all the storms do go away. Except for the occasional shower that lingers. Ecologists at North Carolina State University are asking for the public's help in collecting the various creatures that live in people's homes in order to sequence and identify them. Wired magazine reports that the researchers are looking for 10 homes from each state, 5 in urban areas and 5 in rural areas. They hope to both uncover new species of microbes and learn more about which microbes grow where. I would venture to say that if they just wandered around the dorms at NC State, they would find millions of unidentified microbes. Just check the fridge and laundry basket of each dorm room. Well, that's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for tuning in. Hope you survived the hurricane and stayed dry. Time for me to go dry off. We'll see you next time. Sit, Beaker. Sit. Good dog. It's really cold. It's really cold. Stop. It's really cold. I can't speak. I got lost because it was so cold. It was catching my breath.